And good morning, everyone. Brand new edition here of Sports Medicine Weekly on this Saturday morning. So happy you're with us. My name is Steve Cashel, joined by my usual co-host. He is Dr. Brian Cole, head team physician for the Chicago Bulls, one of the co-team physicians for the Chicago White Sox, sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. How are you, Dr. Cole?
Steve, I'm doing great this morning. It's good to see you.
Good. I want to go back a couple weeks ago. I understand you had a little skiing accident. Where do you ski? In Deer Valley, Utah?
I'll ski in a lot of different places, but that's one of my passions. It's one of the things that I love to do with family and kids. And yes, right over Christmas we were in Utah, and I was skiing with some very good skiers. And what's interesting, if you're a skier, and I know you board, they had great fresh snow, but they don't have a ton of depth, right? So you can be disillusioned in terms of how good it is. And we were sort of going out of bounds through some gates that on a traverse, and I was following an excellent skier. I was also with a ski patrol who was off duty, who's also a friend, and the woman in front of me, I sort of heard a little bit of a scream, but didn't see anything. And then I come around this corner because it was it was better coverage than it was the run before, and I skied directly into a tree trunk that's sticking horizontally at the level of like the middle of my tibia.
Oh.
And had I not come out of my ski, I would have for sure broke my tibia and my fibula for sure. It was really hard, and I mean it was amazing. It was like hitting a truck. So the one of the lessons is that even though you feel you're really competent at that sport, the dangers are really in the unknown. I get lots of people on a weekly basis during the ski season who are skiing, and one ski sort of wanders to the left or the right, and they injure their knee and their ACL, or they get out of control and they hit a tree and separate their shoulder, dislocate their shoulder, fracture their clavicle. This is one of those things where the terrain is so unpredictable, and you can't always see these things. They're just obstacles. And I just really had a huge impact on my lower leg. Not fun.
All right, so interesting story. I'm sorry that you got hurt, but
I'm okay.
I find it interesting is how does a doctor treat a doctor? So do you immediately diagnose what you have?
Well, so the first thing was I wanted to make sure I didn't fracture or break my tibia. So it was so painful when it happened that I'm just laying there in the snow out of my skis. I kind of flipped out of the skis, and I'm trying to bend my leg to see if it's moving in a place it's not supposed to move. If I had fractured my tibia, and it didn't, but it was just kind of numb with pain. And then I just sort of got my wits about me, put my foot down to see if I could load it, and I'm like, okay, I can load it, so I must not have fractured. So the average individual is not going to know to do that. The average individual is going to stop and probably just panic and say, "Get me some help." I at least knew enough to say, is it broken or is it not broken?
Let's educate our listeners, for those who may not know. Tibia, that bone.
The shin bone.
Shin bone between the knee and the ankle, right?
Correct. And the fibula is the small bone on the outside of the leg that is less consequential, but if you break your tibia, you can't put any weight on it.
Okay.
So then I knew because of how I hit it that it was going to bleed and it was going to swell significantly. So I could actually ski down.
You mean bleed internally?
Internally, because you just know with that kind of blow that something's going to bleed. And I could see like there was a mark on my leg. It was red, but I actually thought I burst the skin open, but I didn't. So I skied back and to our place because I just didn't want it to happen when I was out in the field because I knew it was going to be bad. And sure enough, within an hour, it looked like a grapefruit on the front outer side of my shin, and there's not much capacity there. It's a very tight space. And then my foot's starting to go numb because it's pressing on nerves. I knew everything that was happening, but to be honest, you got to be objective. And if this walks in my office, I feel like I know what to do.
Yeah.
When it happens, when it happens to me, my concern was that I would not be completely objective and could ignore something. Do you follow me?
Yeah.
Because I've been very blessed that I do a lot of some extreme sports and never really had a significant injury. And you think you always know, but I kind of knew that I should ask for some help because it's one of those things that if you ignore it, you can get what's called a compartment syndrome where the nerves are compressed, they're deprived of oxygen, and you can actually permanently compromise the nerves in the foot if you ignore it. So there was ironically an orthopedic surgeon there that at the building we were at, and he wasn't an expert at it, but he helped me have some objectivity, and I met with him, and we kind of talked about what to do because I didn't want to rush to the emergency room, and frankly, as long as I knew it wasn't an overt fracture, there was no reason to immobilize it other than to put compression on and try to stop the bleeding, which was not insignificant. So
That's my
little
question.
freaky.
How did you treat that then? Is it
so
ice and is it
yeah,
elevation?
the first thing was ice, and because ice can in compression, I got 2 ACE wraps, elevated it, and so it's rest, ice, compression, elevation. So that's a basic one, right? That's your ABCs of trauma management, and that's what I did. And it definitely, I think, helped, but it was still so insanely swollen. Like my leg on that side was 3 times the size of my other leg within about an hour and a half. And I just didn't want to get a compartment syndrome, which is where the nerves are compressed because the blood is just too tight and there's no place for it to go. So yeah, rest, ice, compression, elevation. The first 24 hours a little bit hairy, and I actually had a trauma surgeon on call at the University of Utah in case I needed to go in. I just said, "Look, are you around tonight?" As a guy I knew, and I said, "If I call you, you know I need you." And so I know what symptoms to look for. If this happened to you and you were out in the field, whatever, you would need to get help so you know what to look for, because there's certain things you cannot ignore. I knew what I could not ignore. If you have horrible pain with passive motion of the foot that's not controllable by any medications that you have, that's a trip to the emergency room. So if anyone has a significant soft tissue injury where their foot is getting numb or their arm is getting numb and they have just horrific pain that they've never experienced before, that's a don't pass go to the emergency room. So I was aware of that phenomenon. I know enough, that's our basic training, that if that was the case, you go to the ER.
Good takeaways.
Yeah. So anyway, just, I tell you, I talked when I lecture around the country about being active and preventing injury and staying healthy. I will tell you that the most important thing is just don't get injured. You know what I mean? Out of all the things that we talk about, Steve, people are looking for longevity, for staying active. The real pivot point is if you get injured, that's what takes you out of the game, and that's what leads to long-term consequences. So be safe and try to predict the unpredictable.